Hello, everybody. Welcome. I'm going to give everyone just a second to connect to the audio. All right. Looks like we are pretty good. So welcome, everyone. My name is Becca Melnick. I am the Associate Director of Admissions here at the Yale School of Public Health. I recognize many of your names. I've seen a lot of people at events this week, and I know we've connected a lot over the last few months. So welcome. Thank you for joining us today. Today's session for our Executive MPH Virtual Open House is about the critical topics in public health track. As many of you know, we've had other events throughout the week for the other tracks, about the program in general, about financial aid, and we have 2 additional events coming up this evening about career services and tomorrow about the intensives. So we hope to see you on those as well. And everything is recorded and will be posted online. So if you've missed any sessions or can't come, you will be able to see them. In terms of other housekeeping things, we want this to be helpful for you. We want you to be able to ask any questions you have about the program, the track. So please feel free to use the chat to ask questions and to really kind of engage and ask whatever would be helpful. So I think that's all I have for housekeeping. So with that, I will turn it over to Marnie White, who's the track coordinator, to speak more about the program.
Hi, thank you all. It's really nice to see you. Thanks for attending this section of the open house for the Executive MPH program. Today, I just want to provide a bit of an overview of this specific track, introduce myself, tell you a little bit about the faculty who are teaching the courses in this track, and a little bit about what that curriculum looks like. So I am Professor Marnie White. I'm the track director for the critical topics in public health track. And I'm an associate professor in the social and behavioral sciences, and I'm going to be teaching one of the core courses, the core course in health behavior change. But as track director, I will also be the point person for you during your time here in the program. And I am so excited about this new MPH program because I actually completed a degree here at Yale myself. And I had a cute little animation to show you that I'm a Yaley and got my MS here, but I've apparently lost the ability to function my PowerPoint after I don't know how many years of doing this. Sorry about that. But I was very lucky that I was already faculty in the School of Medicine in the Department of Psychiatry, which is housed just across the street from the School of Public Health. So when I was faculty in psychiatry, I was able to come over to public health, get my advanced education, and then ultimately moved over across the street as faculty here. But I recognize that picking up your life and moving to New Haven for 20 months is not really feasible for people depending on various life circumstances or where you are in your career. So I'm so thrilled that this is now an option for professionals throughout the country if your circumstances don't allow for that, for the in-person joining of the curriculum. So this is just a real thrill to have seen evolve over the past couple of years. Oh, look, there's my animation now. Okay, so I know that the other presentations already focused on the broader curriculum and program overview. And so today I just want to focus more on the curriculum specific to the critical topics track and to introduce those faculty. And then of course, at the time, please feel free to interrupt with any questions. Very much my style is if something is unclear, throw a question into the chat, which I can't actually see, but Heather or Becca could interrupt and pose your question at that time. So please feel free to make this as much of an interactive Q&A as you are comfortable doing. But we'll also save time at the end. So the critical topics track includes 3 focused courses on what we see as the essential public health skills. And these are monitoring and evaluation of public health programs, leading transformational change within institutions and organizations, and public health modeling, which is of course a more in-depth biostatistical approach to understanding the complexities of public health. So Dr. Rafael Perez Escamilla is teaching the monitoring and evaluation course. Rafael is a tenured professor here at YSPH and is also in the Department of Social and Behavioral Sciences. And a lot of his work focuses on nutrition and maternal child health, and more broadly in global implementation science. And he has received numerous awards, many accomplishments, including being a member of the National Academy of Medicine. And Rafael's course on monitoring and evaluation will cover the the monitoring and evaluation principles, concepts, frameworks, and methods. And it will be a very heavily real-world, case-based course. And the case studies that you'll be doing will be how to learn how monitoring and evaluation can be used in designing and implementing high quality and equitable public health programs on a large scale. Bless you. The next course, the Transformational Change course, will be taught by Dr. Zeev Neuwirth, and he is a physician and a physician executive with experience in healthcare management. And he's also the creator and host of the podcast, Creating a New Healthcare, as well as the author of the book, Reframing Healthcare, a roadmap for creating disruptive change. And so his course, which hits the same themes as his book, will provide real life examples, again, very case-based, experience-based insights and practical guidance on how to maneuver through what Dr. Neuwirth describes as the minefields of healthcare organizations, all with the end goal being to create positive change within them. And then finally, Dr. Olga Morozova will teach the public health modeling course. She is also a graduate of the Yale School of Public Health in the epidemiology of microbial diseases track, and she did her postdoc here in biostatistics. And her course will be tailored to a broad student audience, but it's a quantitative course. So students will be expected to have already had some quantitative background, such as basic probability and basic coding skills, which of course you will get through the core biostatistics class during the first year. And the course will involve problem sets, which is the Yale word for homework. And so these P sets will be hands-on applications of modeling techniques. So this could include coding and analysis and interpretation. And another skill which Dr. Morozova will be hitting, as well as really most of the courses, will be in the review, evaluation, and discussion of scientific papers, which will enable you to be very critical consumers of the research literature. So regardless of whether you are pursuing this degree to become a researcher, one of the key skills for people who even going into more of an applied practice setting will be to really be a very critical consumer of the scientific research literature. And so that's certainly a skill that will be integrated into the course that I teach as well. And so that concludes my overview of the three courses. And so now I'd like to turn it over to you for any questions that you might have, and I will stop screen sharing unless you have a question about a specific slide. Does anybody have any questions? And this can be things, life, my course, the courses in the critical topics. Marty, do you have any questions? I assume you all have met Dr. Klein.
Yeah, I've had a chance to meet most of you. Hi, thanks again for joining us. Thank you, Marty. I don't have any questions. I'll just say one thing about Professor Morozova's course from having chatted with her several times about it. There's an applied part of it, but the key component of it is for you to be able to understand modeling, its benefits, how it works, being able to sort of do a critical review of the literature where modeling is used. So you're doing in order to understand, you're not expected to become modelers at the end of the course. And, the work that you've had sort of in intro to biostat or the, intro to epi course will, adequately prepare you to do whatever problem sets you need to do in the course.
I have a quick question. So my understanding is that with the on-site MPH, there's a healthcare management track, correct? So for those of us who have interests that lie in that area, would this be the appropriate track to focus on?
Marty, do you want to weigh in on that? My sense is yes, given that this is the access to Dr. Neuwirth's course. Would you, from my review of the various tracks, this is the one that would align most closely with the on-campus healthcare management track. Of course, that track is actually a combined MPH MBA, and so students are actually taking many more courses over in the business school. But this class, which was created specifically for this track, really feels more like the industrial, organizational, or human resources bits of the curriculum. Marty, is that accurate, would you say?
Yeah, I would agree. I mean, I would say if someone, has a strong interest in developing, sort of the knowledge, skills, and abilities around healthcare management or health policy and management, this track is not equivalent to that. So, this is the closest, and combined with some of the other courses and some of the other tracks, you will get, I think, a good foundational knowledge, but it's not meant to suggest that it's equivalent to having a track or a program in healthcare management or health policy, because it's not. But you can develop a lot of the useful skills that you'll need to be a good healthcare manager, especially when you combine it with the intensives, especially when you combine it with the course using evidence to drive decision-making, especially when you combine it with the capstone that integrates a lot of these things. So you can get there a lot of the way, but it's not the same as a healthcare management degree.
Thank you.
We have another question about this track, and there's one that I believe Paula's question is about my class, so I'll come back to that since that's one of the core courses. We have another question about the essential skills and competencies that one can gain from this track. This track hits on what we see as the most critical skills in public health. So it's designed to be a comparatively broader or more encompassing track than some of the others, such as the modeling track. So we're looking for this track to be the one that is most able to be catered toward a broader array of public health professionals. So you'll walk away with some more heavily refined biostatistical modeling skills. You'll know more about healthcare management, which is something that is not generally addressed in any of the other tracks. And of course, the implementation global element that Raphael will be teaching. So this really has to do with effective evaluation of public health interventions and campaigns, as well as identifying the kind of the obstacles there and how to address them. So it's a very applied approach in this particular track. Marty, do you have anything to add for that one?
Yeah, no, yeah, as you said, there is no sort of disciplinary boundary around this track. There is a way around the others, but I sort of think of it to some degree as sort of, habits of mind. The way you critically assess and understand what's happening through the use of these various tools that you learn, I think are very important. So it's really, when we created the track, it was around, what are some of the key important areas that we think public health professionals need to understand to work effectively in their organizations? And, these are three that I think, most public health professionals would agree are important areas to understand and explore. Public health modeling, which some people might think, I don't know, if you think about the pandemic, what is so much of the work about? It's about modeling, future impact and determining actions and policies based upon what we've modeled we think will happen in the future. So even something that isn't necessarily intuitively something that I need to know that, it turns out it's becoming more and more important for everyday working professionals in health.
There was another question here, I think for me, about my core course. Is that correct, Paula? And I'm not able to see you.
Yes, that is correct. Thank you.
Sure. So the course that I'm teaching is very much, it draws from my background as a clinical health psychologist. So to give you a little bit more background as to how this entire class was created and evolved, I obviously for the first part of my career worked in clinical interventions, and I came over here to become cross-trained so that I could learn more about prevention science. Because as we know in public health, it's much better to prevent the onset or worsening of disease than it is to cure it. And so I really wanted to shape my research work and my applied work to more of a prevention standpoint. And so this course actually evolved from a foundational course in social and behavioral sciences, and then became a course in health behavior change, because we determined after several iterations of the course that actually applying theory is much more difficult than many people believe it to be. So we can say things to people like, hey, be sure to eat 5 fruits and vegetables a day. And that doesn't necessarily translate to any action beyond the physician or the public health practitioner saying, hey, please go do this. So the course is really about identifying obstacles and incentivizing behavior change using behavioral theory. And so in the discussions themselves, it's an experiential course. And what that means by experiential course, it means that I encourage students to apply the public health practices to themselves, as if you are a community resident, and we are trying to encourage an entire community to engage in small bouts of physical activity, or to drink more water, or whatever the case may be. We choose a small modifiable health goal and apply best practices to ourselves. And the discussions are actually around how very difficult that is. And so I'm very big on empathy training, but also because not just because it's good for you personally, but it illuminates so many of the pitfalls or the minefields that we, as a general field of health promotion or treatment, find ourselves in. I don't know how many physicians might be in the group or people who are currently in practice of any kind, but this is something that we hear from professionals and from patients or clients alike repeatedly is, well, you should just lose weight. Well, you should just exercise more. Well, you would be much healthier if you did this, but we don't really equip people with the tools to do that. So the discussion elements of that course will be more applied practices, everything from trying to design an intervention to critique interventions, exploring the literature, but also evaluating the different kinds of behavior change techniques in groups, sharing our experiences. I will encourage all of you to embark on small behavior change activities, and I will be doing them along with you, again, to kind of model what we know about the importance of leadership in promoting community level health initiatives. It's a fun class. I'm really glad that
it sounds very fun. Thank you, Dr. White, for your answer.
Sure. If you had the opportunity to want one class to this track that isn't covered in other tracks, what would it, for me personally or everybody? Marty knows my ideas. And it would actually, my fantasy would not be, okay, me personally, my fantasy would not be this track specifically. It would be to create a new track. And that would be one on that focused on multiple components of behavioral theory. So it would include behavioral economics as well as health marketing. I think that there's a wide open, everything from most of what public health does is focused on PSAs, but I think that we really need to capitalize on the changing landscape of where people derive their health information. And so there's a good bit of research coming out now that people are more likely to trust social media than they are their own physicians. So I would like to include a course around health media. Perhaps James Hamlin's course, for example, could be either included or adapted. So if you don't know, James Hamlin is the healthcare correspondent for The Atlantic and has been for the past several years. He's a physician. He's now on the faculty at Yale and teaches a course that I'm actually going to take this semester. He's going to let me take his class as a professor, but which I'm thrilled about. But it's about engaging with mass media outlets to promote or to make more disseminable and accessible information that sadly often stays within the professions. So it's about how to translate our research knowledge so that individuals in the community can access it and use it and make their own decisions accordingly. And I think that's a real need in the field of public health. So my fantasy would be to integrate kind of behavioral health psychology with public health, because I think that psychologists know a lot, and I think that public health knows a lot, and I think that together we would be a huge force. So my fantasy is on the behavioral economics, behavioral health communications. Let's see. Thanks, Brett, for that question. That's a fun one. Critical topics leaning more on individual or group work. Thank you. Now that's very interesting. I do not know the answer to that question. Ronaldo asked if the critical topics track is leaning more towards individual or group work.
It's more group work, and this gets to the larger point about creating a learning community. So we've been very conscious and deliberate in thinking about how we want to structure not only the courses but the programs, and what are the important elements that we want to consistently introduce and apply throughout the curriculum. And one of those is this notion of a learning community. And that's that, especially with this group of experienced professionals, that you will learn from each other and engage with each other in productive, stimulating ways, as well as engaging with the faculty members. So one of the things we're encouraging all of the faculty members to do, and we've provided guidelines and suggestions on how to do it, is group work, fostering a learning community, and interaction. And certainly in this course, like Raphael's course, on monitoring and evaluation, that's case-based learning. And we're actually going to be introducing some additional case-based learning opportunities for all of the faculty. So it leans towards group work, yes. And that's something that I will say that we're encouraging for all of the tracks and all of the courses, is as much as possible to provide group-based opportunities to engage and learn while you're learning the material at hand.
And kind of drawing off of that, we are also very sensitive to the fact that people will be remoting in from very many different time zones potentially in areas. And so we are aiming to build more of a community learning and to try to overcome any kind of splinters that might exist as a result of people just not being able to meet face to face. And I think that we've developed skills as a faculty over the past 12 months that we've got some pretty good systems in place. And I've been kind of amazed over how well we've been able to build that community within courses, if not across the entire curriculum. So I'm very optimistic, and again, thrilled about this opportunity, and that we've been able to launch the program like this to invite you all to join. It's so exciting for me personally.
And also, let me just add, while I've got Professor White here as the track director, in her role as faculty member and course faculty member for the health behavior change course, not every school of public health has a core course in this area. And one of the things in public health is we know so much about what individuals can do and should be doing to improve their health. We haven't figured out how to have them do it. Now, there are a whole range of structural issues as well that impede and mediate that opportunity to engage in productive behavior change. But it's a huge topic that I think, every student who graduates from a school of public health should have a firm foundational knowledge in behavior change. And, we are really fortunate to have Professor White as a core faculty member teaching that very topic.
Thank you. And I love to teach it. And I don't even mind giving away some of the spoilers about the class either, if anybody's interested in hearing that. The class evolved this way from a broader survey course, somewhat in response to my increasing concerns about students' well-being. And so that experiential piece was something that I intentionally designed to incentivize students to engage in a variety of self-care behaviors. So I had been doing work around mental health and mental health prevention, and sort of, lecturing students unsolicitedly that they needed to, or that I would wish for them to not drive themselves so hard. And to really try to take active steps to protect their own mental and emotional well-being. But that's all good and well, right? That's that same model of being the healthcare provider saying, you really should do this, without really equipping people with the tools to do it. And so I decided to incentivize students to do it and dangle extra credit points in front of them if they engaged in a variety of different self-care behaviors. And it's much more complicated. I'm simplifying the exact methodology for you. But one thing that I found that seems somewhat universal for Yale students is that they're quite motivated by good grades. And so when I said to a student, hey, you can get an A on this assignment if you take Sunday off from studying, and go for a nice nature walk, all of a sudden they were able to justify that time because they were doing it not only for their well-being but for their grades as well. Now, of course, there's a lot more of a learning paradigm going on here because they are applying the behavioral theories and they're critiquing them in reference to the existing literature and to existing interventions. But ultimately, that is what the class is doing. You're learning by doing, and you're also taking care of yourself. And we've been collecting data on this over the past several semesters and have found that over the course of the, what will be an 8-week behavior change experiment that you are conducting on yourself, we are detecting clinically and statistically significant reductions in depression, anxiety, and stress levels simply as a result of engaging in these daily activities. And they are typically something very minor, like a 10-minute yoga YouTube video or a walk around the block every morning. It's just something where you're protecting time to engage in self-care activities, and it has to be just some slight modification to your existing, routine. But through various mechanisms, I think potentially increases in self-efficacy and just kind of, and then of course the known effects these have on physical and emotional well-being, where it's just something that I'm very pleased to be able to offer because it serves as something that benefits you not only professionally, obviously, but people actually derive personal benefit from it. And I know I do as well. I mean, part of that is I engage in it with you, recognizing that, I too have to overcome the obstacles and establish all the behavioral contingencies for myself, because otherwise I won't do it. And so in some ways it helps me to be accountable in leading you through the course, that it becomes this kind of community well-being. And it just makes me happy that it actually really helps, and it helps establish people in their public health career to establish and have these skills at hand. So that's that. Sorry, I'm rambling about my own class and not the track itself, but in my opinion, I've got another, what is this track suitable for what kind of student in terms of background or career aspirations? I think that this is the most general of the tracks. So if you are someone who wants to work in the public health world or in the general medical practice world with more of a prevention lens, I think that this is the appropriate track as compared to one which is going to be more modeling focused or biostatistical. This one is more of a, I think, applied practice track. Case competitions. Oh, yes. So students in this program would be able to participate in the, oh, thank you. We're going over time, but I can stay if others are interested in staying. There are Yale campus competitions that feed into the Emory case competition, and that's open to all undergraduate and graduate students. We also have a variety of other competitions, such as creating multimedia PSAs or the film competitions that students compete in the YSPH sponsored competitions. That's so fun. Yes, so yes. We would be able to find, faculty mentors, and I guess you typically have to submit in these case competitions with a faculty advisor. So,
yeah, and also, and this isn't finalized yet, but one of the things that I'd like to do in the third, in each of these 5-day on-campus intensives, there are opportunities for sessions that don't focus on the intensive at hand. And so in the third intensive, actually, what I'd like to do is to have a case competition just for the exec MPH students. And, one of the things we're thinking about are themes that we'd like to introduce and, sort of build upon, and, this isn't sort of official yet, but at least implicit, if not explicit, we'd like students to always be aware of health equity, global health, and climate change in health as three important areas. And so, one idea is that in this case competition, we'll ask you to sort of look at and integrate, these areas. But, there are case competitions outside of the program that are accessible to you. But I'm actually thinking for the third intensive, we'd have a case competition for the exec MPH students. And there was an earlier question about would Professor Hamblin's course be available to you? So, as you are a student at the Yale School of Public Health, you get the same ID card, you have all of the rights and privileges and responsibilities as every other student at the school. Obviously, many of you are not in the proximity of New Haven. So if you are, though, then, with the instructor's permission, like any other course, you can audit a course at the School of Public Health. But in terms of that course being available to you as an online student via an online platform, it's not. But, one of the things on my to-do list is because we've gone virtual and we do have all classes are being recorded, the idea of maybe creating some sort of a bank of lectures that students can sort of just, on their own access is something that I'd like to explore, but I certainly can't promise that.
That's something that I've been doing spontaneously in my courses for several years because there have just been some interest in my class from other schools and departments throughout the university. And because I feel devoted to the YSPH students, I don't want to kind of diffuse my attention away from them. So I've allowed auditors from other programs and departments, but only to view my recorded lectures. So not to actually, so people can audit, but that's something that I've already got built for all of my classes, Marty. And I imagine that others have as well, because we do get these requests quite frequently. And so, yeah, I allow people in to audit my class. And through that, they have access to, the lectures, the readings, and all of that, which is actually what I had requested of Dr. Hamblin. I said, hey, can I audit? Because it's all online right now, I can actually attend. And he said, no, but you can take it. I'm like, oh, okay, I'll do that. So he's like, you're going to be participating in writing. I'm like, okay, that's good. That's good. Keep me accountable. I'll do that.
There is a note in the chat for all of you posted by one of your colleagues about a meetup tonight at 8. So if you're not looking at the chat, I'd encourage you to take a look. And then there's a URL where you can sign in and get more information. And of course, we'd love for as many of you as possible to participate in that.
Do you think it's fair looking at the three different courses? It seems like from the descriptions, the monitoring and evaluation and the modeling courses are more kind of like concrete skills. Do you think that leading transformational change is kind of more, it seems more like case discussions or like, I don't know, it just seems more vague as far as like the skills that you come out of that course with. Do you think that's fair?
I don't think it's fully accurate in the sense that there are templates and methods for how you lead transformational change. So it's not just about, stories and cases, but, actual techniques and methods that you use, and then you apply those if it feels like it's a fit for you. So it's partly empirically based, and it'll have tools and techniques that you can apply in order to, promote transformational change.
Okay, thank you.
Any other questions, things, life, whatnot? I'll chat all day. So
I have
you'll
a
learn
quick
about
question.
me.
Can you hear me?
Hi. Yes, I can. Hi.
Hey, this is Edvish. Sorry, I think I'm using my son's Zoom, so it says Yaniv, but this is Edvish. So my question is, as far as the weekly group discussion with different classes, are we gonna have a separate day for each track to meet online? Or are we all meeting together? I'm still a little confused as far as how that's gonna work.
Yeah, so you will, the core courses in year one, everyone will be in those core courses. So every student is taking those courses. In year two, then you take your individual courses based on your interests and your track. And so you won't all be together. You'll be, in those courses by track or area of interest. But there will certainly be opportunities for all the students in a track to gather as a track with the track director.
Okay.
So in year one, you'll all be together for all the courses. In year two, you'll be in your own courses and your own tracks, and you'll have opportunities to gather as a track as well.
Right. I think part of the question was also about scheduling. So whether or not, for example, you would have all of your discussions on like a Friday or something like that. Is that what you mean? So like my class involves a lecture component, which is done asynchronously.
Mhm.
And then we will have a weekly discussion section
Okay.
on a specific day and time, just for an hour.
Okay.
Correct. And so that's where, but in terms of, I don't believe we've worked out the grid in terms of scheduling those.
Yeah, in the general template is that we'll have the discussion sections at 8 p.m. during the week, Monday through Thursday, to account for people on the West Coast. And then depending, and the core courses will be larger by definition than any course that's offered in the track in terms of the number of students. So if we have, say, 3 discussion sections in year one for the core courses, depending on student interest and the availability of the discussion leader, we might have, in addition to 2 evening discussion sections, we might have one on a Saturday or Sunday if there's enough interest on the part of the students, and we have a discussion leader that can do that. And then you would be expected to always come to that. So if you signed up for the Tuesday discussion section, you would be expected to always come to the Tuesday discussion section. If something happens, of course, stuff happens, then, with the permission of the instructor, you could switch. But we would ask you not to do that very often because there's a certain cohesion that comes from being in the same group with the same discussion section leader.
Right. So it sounds as though we will have multiple discussions for each course, and those will be assigned in collaboration with the student's schedule to make sure that, for example, if you have a commitment and can't attend a Tuesday night at 8 o'clock, then you might be able to do this Saturday morning 10 a.m. or the Thursday night at 7 or whatever the case may be.
Okay. So the follow-up question on that would be, if we go on campus for the intensive, or if we end up doing it online, when we come back from that intensive, are we taking 2 classes for the summer, or are we taking 1 class after another?
You'll be taking 2 classes concurrently. So
Okay.
the way this is structured throughout the 2 years
Mhm.
is that you'll be having, roughly 2 classes per semester, and there are 3 semesters, summer, fall, and spring, and you'll be taking 2 courses. In the second year, there's also a capstone project that runs across the entire year, but that doesn't entail weekly meetings. It entails some meetings, but it's not weekly the same way that a course would be.
Okay. And for
And then the intensives the intensives are designed to be not at the same time that you're taking. So 2 of the intensives are in June, prior to the start of the semester, and one of the intensives is during the spring break.
So the intensive is going to be, I think, June 23rd to the 27th. When does the semester actually start for the 2 concurrent classes?
Roughly around July 1st. There are some issues around the schedule that we need to finalize, but it's going to be roughly around July 1st.
Okay.
And it runs for 7 weeks, right?
Right.
Okay. And then, I'm sorry, the follow-up question on that would be, during the second year when we are doing the capstone, I think we have to do 100 hours, right?
100 hours on the project, yes.
Okay, 100 hours. Is there a possibility I'm mostly interested in doing a project I don't know how my schedule will allow it, but that's my aspiration, to do a project somewhere in Africa. Is there a possibility to make the trip if I want to and have hands-on, to have a hands-on experience trying to apply whatever I am learning in the program?
Yeah, so, our default is that we encourage students to do a project, at their place of work, because it's just easier, just in terms of scheduling. And there are questions around what kind of project. It can't be a project that you would normally be doing anyway. It has to be additional. But you can also, if it works with your schedule and your work demands, do a project with an organization that isn't at your place of work. That's totally fine. Africa would be great. And I've worked with lots of students who have done various kinds of projects and startups in Africa. So you could certainly do that with the permission of the instructor. The trip itself wouldn't be funded in any way by the program, but with the instructor's permission, if it's a defined project that's doable, then you could certainly do a project outside of your place of work, and Africa would be a wonderful opportunity to work on a project there for sure.
Okay, thank you.
I think the pragmatics around the timing and the extra discussion sections, I mean, we are approaching all of this with the goal is to be able to keep you engaged and retained, while also recognizing that you have other demands. And so, my approach, as it has been throughout the entire pandemic circumstances, are, I have students remoting in from a 12-hour time zone difference. And so if they're not able to make a discussion section, I come up with a different alternative. So at least, I certainly can't speak with the rest of for the rest of the faculty, but my approach and priority in all of this is to make sure that it provides you with a solid public health education and experience, but not to the extent that it sacrifices, seeing your child's recital or something like that. So, I intend to approach this with a, here's where we are, and I want you to be there to learn and to get from the experience, but I'm also not out to tank your original career because of, attendance demands, if that makes sense. And I believe that's probably pretty common throughout the faculty who, opted and asked to be able to teach in this opportunity. And I'm also a big fan of distance learning, having been taking courses at a distance modality since the 1990s. It works with having a job and other life demands. And so there's certainly been the case when I've not been able to pick up and go to an in-person class, but I've absolutely been able to do an asynchronous distance learning.
And I have one more question. So I really appreciate it's maybe a comment. I appreciate after listening to all the different sessions throughout this week and trying to have a better understanding of the different tracks and what is the expectation. I appreciate that the program, my impression is that the program is trying to be very flexible, in terms of, the scheduling and how we go, this whole thing is going to work in the middle of the pandemic. My fear was in the beginning, being in clinical practice, it's not like I don't always have the flexibility in my time. If I have a patient, I have a patient, and sometimes you work long hours and you don't get to go home at 5 or 6 or whatever. So I was concerned about how am I going to do this because my regular schedule is from 7:30 to 6. But again, 6 is what's on paper. I don't always get to go home. Sometimes I work until 9 p.m. And so I was a little afraid about how this is going to work with my work schedule. But it seems like, if we're gonna have different discussion session during the week and I can choose one that better suits my schedule, I think that would be a great opportunity. And so I really appreciate, you guys trying to be flexible with us. And my other concern is that I am also a U.S. Public Health Commission Corps officer. So I get to be deployed because I'm active duty. And so I don't have control over that either. And I have certain month where I am on call for deployment. So if there's something, then I'm on call and I have to do that. And so I really appreciate the fact that you just said earlier, if for some reasons, you can't attend this session, if we can find alternative way for the students to be able to complete the work just because of what we do every day, I can't just stop, I can't say, don't deploy me, you know what I mean?
Of course, no, absolutely. And I just took a picture of my recent Zoom call with students I taught this morning. And one student was driving on the Zoom call. Another was actually remoting in from the hospital. Another was at home, and another was in the basement of YSPH, having stepped out of the library or something. So, I was kind of amused of like what teaching is now. But I would say even in the in-person courses, we've got advanced MPH students who are physicians and who are up against a grant deadline or whatever the case may be. I look at all of this as education, but not, and so it needs to be on my terms. It's more about I'm providing a service to you, and therefore, attendance is certainly valued and encouraged, but it's not ridiculous either. Like we recognize that you have patients to attend to. And so we'll work to make sure that we are able to provide you with the full education despite the occasional course that you might need to miss.
Yes, okay.
I do want to be clear though, without, sort of misleading anyone, that there are expectations around attending discussion sections. And, the challenge in year one, I think there isn't much of a challenge in terms of finding a discussion section, because just to get into the weeds just a little bit so that you can understand this a little bit better. Basically what happens that when a class enrollment reaches approximately 20 students, then a discussion leader, a teaching fellow is assigned. So with each increment of 20 students, a discussion leader, teaching fellow is assigned. In year one for the core courses, since we're projecting or hoping for an enrollment of at least 40 students, that shouldn't be a problem. We will have at least hopefully 2 discussion leaders as well as the faculty members. So we'll have 3 discussion sections. In year 2, there aren't core courses. People are selecting individual courses. The critical topics track is the one that received the largest number of applications, and I'm assuming that's tracked through to the largest number of admissions. In some of the other tracks, so for example, health informatics, there were not a great number of students who applied for that. So I could definitely see in health informatics that those courses would have fewer than 20 students. So if a health informatics course, say, had 15 students, then there would only be 1 discussion section that would be led by the faculty member. And that would say be hypothetically Tuesday at 5 o'clock Eastern time. You would need to be able to attend those. Now, occasionally stuff happens, but if you couldn't attend those discussion sections for that course, then you shouldn't take that course, because you can miss an occasional discussion section, but you have to be able to participate in the discussion. That's sort of the secret sauce of all of this, is engaging with the faculty members, engaging with your fellow students. It's great that you can watch the lectures, but that's where the deep integrative learning happens. So, we want to be flexible, and we can be flexible, but you also have to know with your own career and your professional responsibilities that you can, as a rule, attend the discussion sections, particularly in the second year when there will be likely fewer discussion sections per course.
Thank Thanks, Marty.
Thank you.
I
Hello
saw-
there. I have
Hi.
to run off to go to my
Okay.
mobile job. I apologize. Thank you both so much for sharing all this information. Wild over again. Hope you have a great day.
Thank you. You too. Thanks. Nice to see you.
I did want to say there was one question in the chat about how many weeks a semester is. So the summer semester is shorter. The summer term is 7 weeks, whereas the fall and spring terms are 12, 13 weeks.
13 weeks typically.
Can you also confirm when fall term begins?
Yes, I can. So the summer term begins July 1st and runs through August, I believe, 12th. The summer term orientation for on-campus students begins August 24th, and classes begin, I believe, September 1st. I'm double checking right now. If you need updates on any dates, there's on the website on the admissions page, there's a new page that was just launched, the Incoming Student Gateway, that lists out kind of all of the dates, deadlines, everything you'll need to do. If you've submitted your seat deposit and plan on enrolling, you'll get more communications from us with links to all of this, reminders and everything else you need to know. But as like a quick overview, that's a great place to look. And yes, fall term classes begin September 1st.
Thank you.
Thank you. Thanks, Marina.
Becca?
Yeah.
When do you think we're gonna have access to the recording of all the sessions we had this week? Because some of them I wasn't able to attend or fully engage in.
Yes, they are being posted as they go. There should be, I'm looking up to see which ones now are already live. 3 of the sessions, the 3 other track sessions are already posted on the webpage. So also in that admissions page, there's information about all the open house events. 3 of the track sessions are already there. The other 2 should be up by end of this week, beginning of next week.
So just go on the Yale School of Public Health website?
Yep.
Okay,
Yep, on there, in the admissions page, there's a specific page for the open houses.
okay.
All right, if there's no other questions, I want to thank you, Marnie, so much for taking the time. And sorry, Martin and Heather, that I didn't introduce you both at the beginning. But Martin, as he's talked about, is a program director, and Heather also works with our executive MPH program. You'll be in touch with both of them a lot. And so any of us are happy to answer any other questions you have. Don't hesitate at all to reach out via email. If you don't know where to direct your questions to, I can always help. Like I said, I hope this was helpful, and thank you, Marnie, and we hope you all have a great rest of your day and hope to see you soon.
Absolutely. And please reach out if anything comes up after this. All right. So nice to see you. Thanks for your interest.
Bye.
Bye.